can you tell us a bit more about what the iSIMPATHY project will actually involve?
Firstly, it's a funded project. It's a 3-year funded project which operates in Northern Ireland, in Ireland, and in Scotland. It's led by the Scottish Government. We received our funding from the European Union's Interreg BA programme, and that is managed by the Special European Union Programmes body. So ultimately, what we are aiming to do in this project is deliver 15,000 reviews over the next 2 years, and they'll be delivered by 10.5 pharmacists who will be trained in the iSIMPATHY delivery. 6,000 of those will take place in Scotland and 4,500 each in the Republic of Ireland and in Northern Ireland. So we're unique in Northern Ireland because we are delivering our medicine reviews in the hospital setting, so the secondary care setting, while in Scotland and in the Republic, they are delivering the reviews in primary care.
And what is the role of the Medicines Optimisation and Innovation Centre here?
Why are we involved in iSIMPATHY? It's because for the last 20 years, really we have been looking at the role of the clinical pharmacist and the improving patient outcomes, essentially. And we have evidenced a lot of work over that period. And what we see with this is an extension of that current medicines optimization service improvement area that we have been working on for a long time. And what we do know is, I suppose, a lot of emphasis is put into an inpatient when they first come into the hospital and just before they leave. And sometimes that bit in the middle can lose out a bit. So this is where we are going to look at the real benefit of this iSIMPATHY project, because the pharmacists will be delivering an intensive medication review while the patient is in hospital.
Mm-hmm. Mm. So what will this involve for the project pharmacists on the ground?
So for us as project pharmacists, then we will be working to deliver these 4,500 medication reviews in the hospital setting. So yes, we are all prescribers, so we're able to action, all of our recommendations ourselves, but obviously in close conjunction with our medical and other pharmacy staff. So we'll be discussing that, because they're patient as well. So we're discussing all of that, but we can action a lot of the interventions ourselves. So we use the Scottish polypharmacy guidance 7 steps procedure to do our medication review. And the first question is, what matters to the patient? This is the patient. It's their life, their medicines. That should be number one, what matters to the patient. And then we also consider what medicines they're on that are essential or perhaps non-essential. We look at, are they meeting their therapeutic objectives? So is that painkiller working? Is the diabetic medicine reducing their HbA1c? So we look at that. We also look at if they're suffering any potential adverse drug reactions, or are they having an adverse drug reaction? And we'll consider if they need side effects, anything. And we'll think about the cost as well. So are they on the most cost-effective medicine? Medicines that patients don't take are not cost-effective. So we're looking at that as well, adherence. And lastly, we're looking at the patient's willingness and ability to take their medicines as prescribed. So there's no point prescribing this wonderful medicine if the patient does not believe it's going to work and will not take it. So it's no coincidence, I suppose, that the patients at the first step and at the last step, they are the center of the decision making about their medicines and their health. And we also provide, as well as looking at the medicines, we're providing a lot of information on non-pharmacological support for them as well. So self-care, how to live with chronic pain, or resources that they may find useful, referring on to other people. So signposting to help them, take better care of themselves and to take ownership of their health.
That's useful, I can see. But pharmacists normally undertake medication reviews. So how will this differ from what they're doing as a rule?
medication reviews do happen. Certainly, you know, if a new drug's prescribed, they'll be checked for interactions, side effects, etc. Or when patients move into hospital, as Clare said, you know, that coming into hospital and getting medicines reconciled properly always happens. But these in-depth reviews that we're doing take a lot of time. So if you're working in a busy GP surgery with only 10 minutes, or you've got a lot of pharmacists with a lot of patients waiting to see you, you don't have time to do this kind of in-depth review. And certainly there are lots of services available, maybe specific community pharmacy clinics or GP pharmacist reviews. And we have specialised pharmacists in hospitals that do brilliant reviews, but it's not for all patients. So we're trying to do that bit in the middle, as Clare says, and trying to review these patients. But they do take time because we're really looking at the patient holistically. And what are their thoughts and their beliefs about their medicine, about their health? What do they want their health outcomes to be? What else can we find out? So, for example, you know, maybe they haven't told people that they drink a lot of alcohol or they smoke, or, you know, all those other kind of things that we can tailor their healthcare for. And we'll also be reviewing things like, are they frail, or what their life expectancy is? What's the number needed to treat or harm with that medicine? But ultimately it's the patient, and a lot of discussion with the patient about what they would like to happen to their medicine. So if we just decide a medicine's not appropriate anymore, we need to de-prescribe that in conjunction with the patient, because otherwise it doesn't work. So it takes a lot of time.